It seems like you always hear about all the amazing things happening in healthcare, right? Like new treatments, groundbreaking research. It's pretty incredible.
Yeah, it really is.
But you know what? Let's take a step back from all those like high-tech headlines for a second and think about something a little bit more down to earth. Have you ever like stopped to consider how all those like life-saving medications, lab samples, and medical supplies actually get where they need to be? Pretty wild to think about.
Yeah, I've never really thought about that.
Because behind the scenes of like every hospital, every home health visit, every hospice care moment, there's this whole network of medical couriers working tirelessly to keep things running smoothly. And that's what we're diving into today. The world of medical couriers, those unsung heroes of healthcare logistics. We've got this fascinating article from Disaster all about this company called Bocsit that's making waves in Massachusetts.
Oh yeah, I read that article. What I thought was really interesting about Bocsit is that they're not just another delivery service. They've kind of taken this often overlooked aspect of healthcare and turned it into a model of efficiency and patient-centered care.
Okay, I'm intrigued. So we're not talking about your average pizza delivery guy here.
Not even close. Think about it. We're talking about transporting things like lab specimens that are crucial for diagnosis, medications that keep people alive, especially for those receiving hospice or home health care, even oxygen tanks and delicate medical equipment.
Wow, it suddenly puts things into perspective, doesn't it? And the article mentions Bocsit goes above and beyond just transporting these items.
Absolutely. For example, maintaining the integrity of sensitive medical goods is paramount, right? Bocsit utilizes temperature-controlled vehicles and packaging, which is especially crucial for medications and lab samples that could be compromised if not handled properly.
Right, like those medications that need to be kept refrigerated or certain lab tests that need to be kept at a specific temperature.
Precisely. And it's not just about getting things from point A to point B quickly. Bocsit incorporates real-time tracking into their system, so patients, doctors, and everyone involved can see exactly where a delivery is at any given time.
That must provide a huge amount of peace of mind, especially in urgent situations.
Absolutely. Imagine a scenario where a hospice patient urgently needs pain medication. With real-time tracking, the family and nurses can see exactly when to expect the delivery. It reduces anxiety and uncertainty during a difficult time.
I see what you mean. It's really about bringing a whole new level of care and attention to a service that often gets overlooked.
Right.
Okay, so they're clearly doing something right. But what sets Bocsit apart from other courier services?
One key difference is their commitment to integration and customization. They don't just show up with a package and leave. They work closely with their partners, whether it's a home health agency, a hospital lab, or a hospice, to tailor their services to fit seamlessly into existing workflows.
So it's not a one-size-fits-all approach.
Not at all. They offer customized training to staff. They work with partners to optimize delivery routes, and even adjust their technology platforms to integrate with the specific needs of each partner.
That's a level of dedication you don't often see. And speaking of dedication, the article mentions a quote from a hospice nurse that really stuck with me. She said, "Every delivery is more than a package. It's a lifeline of care, comfort, and hope."
That's a great quote. That really captures the essence of what medical couriers do, don't you think? It's not just logistics, it's about people. It's about ensuring that patients receive the care they need when they need it in a way that respects their dignity and well-being.
It's a powerful reminder that healthcare is about so much more than just technology and treatments. It's about human connection and compassion. And these couriers are often the ones delivering that.
That's a good point.
Okay, so let's get down to brass tacks. What kind of impact is Bocsit actually having on the ground? The article mentions some pretty compelling case studies.
Yeah. The results are really impressive. For instance, they partnered with a large home health agency in Boston and managed to reduce medication delivery times by a whopping 40%.
That's significant. But what does that mean for the patients and the nurses on the receiving end?
Well, for patients, it means faster access to the medications they need to manage their conditions and maintain their quality of life. And for nurses, it means less time spent waiting for deliveries and more time focused on providing direct patient care.
It's not just about speed. It's about improving the entire healthcare experience for everyone involved.
Exactly. And the impact goes beyond home healthcare. They've also partnered with a hospital laboratory network in Western Massachusetts.
Oh, I bet that's a whole other level of urgency and precision.
Absolutely. By streamlining the transport of lab specimens, they helped reduce transit times by 50%, which led to quicker lab results and ultimately faster diagnoses for patients.
And time is of the essence when it comes to diagnosing and treating illnesses. That's a huge win.
Right. It also resulted in fewer specimen rejections due to improper handling. Because remember, Bocsit has strict protocols and training for their couriers to ensure the integrity of every delivery.
So it's about efficiency, but it's also about quality control and minimizing errors, which ultimately leads to better patient care.
Precisely. And perhaps the most heartwarming example is their partnership with a Boston area hospice agency.
Oh, I'm particularly interested in this one. Hospice care is so incredibly sensitive and personal.
Exactly. By integrating Bocsit into their operations, the hospice was able to improve their response time to patient needs by 60%, meaning they could address pain management, medication adjustments, and other critical needs much more quickly.
Wow, that must have made a world of difference for those patients and their families during such a vulnerable time.
It did, and it wasn't just about the practical aspects of care. The hospice also reported a 35% increase in family satisfaction scores, which speaks volumes about the emotional impact of having a reliable and compassionate courier service involved in their loved one's care.
It sounds like Bocsit is really setting a new standard for what's possible in the world of medical couriers.
They really are. They've shown that by prioritizing efficiency, quality, and a patient-centric approach, medical couriers can play a truly transformative role in healthcare.
And this is all happening right here in Massachusetts. I'm impressed. So where do we go from here? Are these just isolated success stories, or is this a sign of things to come for the entire industry?
That's a great question, and one that leads us into some fascinating trends that are shaping the future of medical couriers.
All right, now you've got me really curious. Let's pick this back up in part 2. All right, so we've established that medical couriers like Bocsit are doing some pretty amazing things, but it feels like we're just scratching the surface here. What about the bigger picture?
Yeah, you're right. There's a whole wave of innovation coming that could completely reshape how we think about medical couriers. It's all tied to the rapid changes happening in healthcare overall.
Okay, give me the highlights. What kind of trends are we talking about?
Well, let's start with something you've probably heard a lot about: telemedicine. Remember how we talked about real-time tracking, giving patients peace of mind? Well, telemedicine takes that to a whole new level.
So instead of going to the doctor's office, you're having a video call, right?
Exactly. But now, imagine you need a prescription refill, or maybe even a specific medical device. Instead of having to leave your home, a medical courier brings those things directly to you, sometimes within hours of that virtual appointment.
That's incredible. It seems like something out of a sci-fi movie.
I know, right? It's becoming more and more common, especially for folks in rural areas or those who have difficulty getting around. And think about lab tests. A courier can deliver the kit, wait for the sample to be collected, and take it right back to the lab.
So it's like having a mobile healthcare team coming to your doorstep.
Yeah.
But how do you ensure these deliveries are made on time and to the right places, especially with something as complex as healthcare?
That's where things get really interesting. This is where the power of AI and predictive analytics comes in.
Okay, I know those terms get thrown around a lot. But in plain English, how can they actually improve medical courier services?
Imagine a system that can analyze things like traffic patterns, weather conditions, and even patient appointment schedules, all in real time.
So no more getting stuck in rush hour traffic or delayed by a snowstorm.
Exactly. Routes can be optimized on the fly to ensure timely delivery. And it goes even further. AI can look at historical data to predict what supplies might be needed where and when.
Wait, so you're saying couriers could be proactively stocked with the right medications or equipment based on predicted demand?
That's the idea. It's all about anticipating needs and creating a more responsive and efficient healthcare system, especially in emergency situations.
That's mind-blowing. It seems like AI could play a massive role in the future of medical couriers. But what about drones? Aren't those supposed to be the next big thing in delivery?
You're right. Drone delivery is a hot topic, and for good reason. Think about those rural communities we mentioned earlier. Imagine a patient needing a life-saving medication, but the nearest hospital is miles away.
A drone could get that medication there in a fraction of the time it would take an ambulance or a traditional courier.
Exactly. We're talking about potentially saving lives in situations where every minute counts.
That's incredible. But I have to admit, the idea of drones buzzing around with medical supplies makes me a little nervous. What about safety and privacy concerns?
Those are absolutely valid concerns, and it's why the rollout of drone delivery is happening carefully. New regulations and safety protocols are being developed to ensure things are done responsibly.
So it's not just about the technology itself, but about creating a whole new framework for how it's used in a safe and ethical way.
Precisely. And beyond those immediate concerns, there are broader challenges that the medical courier industry will need to address. One of the big ones is cost.
Right, because as cool as all this new technology is, it can't come at the expense of making healthcare even more expensive.
Absolutely. That's why companies are exploring innovative pricing models and partnerships to make these advancements accessible to everyone, not just those who can afford it.
So maybe things like subscription services for routine deliveries or collaborations between different healthcare providers to share resources and optimize cost.
Exactly. There's a lot of potential for creative solutions. Another big challenge is the impact on jobs.
The robot takeover. Are we all going to be replaced by drones and AI?
I wouldn't go that far. But it's true that automation could change the nature of some courier jobs.
So what does that mean for the people currently working in this field?
Well, it's not necessarily about replacing jobs, but about shifting them. AI can handle tasks like route optimization, but humans are still essential for things that require a personal touch, like interacting with patients or handling delicate medical items.
So it's about finding the right balance between technology and human expertise, using each to its strengths.
That's the key. And finally, we can't forget about accessibility. All this innovation is great, but it needs to reach everyone, not just those in major cities.
That's a really important point. What about those rural communities we talked about earlier? Are they going to be left behind?
That's the challenge. And it's where things like drone deliveries have huge potential. But it's also about infrastructure and resources. Can these companies afford to operate in areas with limited infrastructure? Can they establish local partnerships to ensure services are available to everyone?
These are big questions. It sounds like there's a lot of work to be done to ensure that these advancements in medical courier services truly benefit everyone.
You're absolutely right. And that brings us to the most important question of all. What does this all mean for the future of healthcare? What role will medical couriers play in shaping that future?
Okay, I'm on the edge of my seat. Let's take a quick pause, and we'll wrap up with those questions when we come back for part 3. Okay, so where were we? We were talking about all these incredible advancements, right?
Yeah.
Like from AI-powered route optimization to the potential of drone deliveries.
Right.
It's pretty exciting stuff, but,
Yeah.
like you mentioned, there are also some big challenges ahead.
Yeah, exactly. And, it's important that we don't shy away from those challenges. If we really want these innovations to truly benefit everyone, we need to think critically about how we navigate them.
Okay, so let's dive into some of those hurdles. You mentioned cost being a major factor.
Yeah. As with any new technology, there's a risk that it could widen those existing disparities in healthcare access. If these advanced services are only available to those who can afford them, we're not really moving the needle on equity.
That makes sense. So how do we make sure that these advancements are accessible to everyone regardless of income or location?
Well, for starters, I think we need to think creatively about funding models. Could there be government subsidies for those essential medical courier services in underserved areas? Or maybe could insurance companies play a role in covering the costs of these deliveries?
Those are interesting ideas. It seems like it would require collaboration between, healthcare providers, policymakers, and even insurance companies.
Absolutely. It's not something that the medical courier industry can solve on its own. It requires a systemic approach.
And what about the impact on jobs? It's easy to get caught up in the excitement of new technology, but we can't forget about the people whose livelihoods might be affected by this.
You're right, and it's a valid concern. But I think it's important to remember that throughout history, technological advancements have often led to the creation of new jobs, even as they displace others.
Okay, so maybe it's not about fearing automation, but about adapting to it.
Mm-hmm.
Could these AI-powered systems actually free up those human couriers to focus on more specialized tasks?
Exactly. Imagine a scenario where AI handles the routine deliveries right, optimizing routes, ensuring efficiency, while human couriers focus on those deliveries that require a personal touch.
Like delivering sensitive medical equipment or interacting with patients who might need extra assistance?
Precisely. It becomes a partnership between humans and technology, each playing to their strengths.
Okay, that makes a lot of sense. And what about regulation? We talked about drones earlier, and it seems like there would need to be clear guidelines in place to ensure safety and privacy with those.
Absolutely. We can't just have drones flying around haphazardly, especially when they're carrying sensitive medical cargo. There need to be strict rules about, airspace management, privacy protection, and data security.
And those rules would need to evolve as the technology advances, right?
Yeah.
It's a constantly moving target.
It is, which is why it's crucial to have that ongoing dialogue between policymakers, industry experts, and the public to ensure that regulations keep pace with innovation while also addressing those ethical concerns.
It sounds like a complex issue, but one that's essential to get right if we want drone delivery to become a viable and safe option for medical transport.
Exactly. And beyond drones, there are broader regulatory questions to consider. As medical couriers take on more complex tasks, how do we ensure they're properly trained and equipped to handle those responsibilities?
Right. And how do we maintain patient privacy and data security as these services become more integrated with the healthcare system?
Yeah, those are all important questions. It's a lot to think about. But I'm optimistic that we can find solutions that both embrace innovation and prioritize those ethical considerations.
Me too. It's been fascinating to explore this, often overlooked aspect of healthcare. And I have to say, I have a newfound appreciation for the crucial role medical couriers play.
They really are the unsung heroes, aren't they? Working tirelessly behind the scenes to ensure that patients get the care they need when they need it.
Next time I see a courier out on the road, I'll definitely give them a nod of thanks. And to our listeners, the next time you hear about home health care, see a lab result or receive a life-saving medication, just take a moment to appreciate that invisible network of medical couriers working behind the scenes to make it all possible. So as we wrap up this deep dive, I'm curious to hear from you, our listeners. What role do you think medical couriers will play in the future of patient care? It's a question worth pondering as we navigate this exciting and rapidly evolving landscape. But one thing's for sure, these often overlooked services are quietly shaping the future of healthcare for the better. Thanks for joining us on this journey.